Oh, yes. So neurosurgery results came back. They recommended from there that I be put on a waiting list to go in for a nerve root injection, okay? So that happened in December, and 90-day wait, so 3 months' time. At the start of January, I ended up using both my osteopath visits. So it was his advice to seek surgical intervention, which I said, well, I'm already on a waiting list for a nerve root injection. Now, the second visit, I think, he suggested to me after I gave him a rundown on what medication I was using, he said, Nurofen is not good for long term. Any medication, no good long term, but Nurofen especially. So he recommended that a long-acting, slow-release, non-steroidal anti-inflammatory, okay, called Celebrex. Now, I ended up with Celebrex in a 200 milligram dose, and I was taking that twice daily. Okay, so that's the second medication, the second prescription medication that I was given. March rolls around and the whole country shuts down in the medical field. Healthcare shuts down, surgeries are on hold, everything gets pushed back with no future date promised, okay? So for the next 3 months, nothing happened, and I went about living in pain as I had before, just taking the medications that made me feel comfortable, and nothing was going to happen for the next 3 months after that. So my 3-month wait period basically turned into a 6-month wait period, and the way that that's happened for me, the way Queensland Health organises their surgeries is sort of shotgun. They don't give you like a future date with much notice. Okay, so basically a week before, in any instance that I've ever had having to deal with a surgeon, I only get a week's notice. So June 26th, I get a date to go undergo my nerve root injection, and I show up, go through the paperwork, I get placed into a CT machine, and the doctors are going to enter my lower back with a large hollow needle, and the CT machine would guide it into the correct position at the L5S1. I got to see it on the screen. It was pretty cool, actually. But the guide needle goes down, and then they administer through a very, very thin hair-like needle, a couple of drugs. I think there was about 3 of them. One was a steroid, one was an anesthetic, and the other one did something else, but I'm not quite sure what that was. But anyway, I was left to recover after that procedure for an hour, and I felt wonderful. I could move again. I didn't have any pain into the back of my knee like I did before, so that was a bonus. And for the next week, I lived pain-free, and everything was good. But nobody told me at that point that I shouldn't go and, behave or maneuver my body like there is no problem, because I will explain why later. But the following week, on the 1st of July, okay, I had a follow-up consult with the neurosurgical department to see how that nerve root injection worked out for me. And I explained everything was great, fine, loved it. If I could live like that for the rest of my life, I'd be happy. Okay, so it was at that point they recommended that I go on a surgical wait list another 90 days to undergo a procedure called a microdiscectomy. Okay, so the microdiscectomy was going to be performed by a neurosurgeon, not just regular old doctors. And it was always on the table. I always had that in the back of my mind that surgery was going to be the likely outcome. So, fast forward to... Okay, so the 2nd of July, and it was a Friday. I was at work and was about to go on 2 weeks holiday. So something at that point, Friday afternoon came around and something wasn't right. I'd never felt as much tension in my back as I had up until that point. And it turned out that this was the very steep downhill slope. Okay, so from the 2nd of July, I'll vividly remember this for as long as I live. I got home and I had a hot shower. I tried to take my medication and sleep off this pain that I could normally do. And it just didn't work this time. I ended up being in extreme agony, just, tears in my eyes. I couldn't find a comfortable position to sit, stand, lay, nothing. And it was just pure torture. It's the only way that you could describe what was happening. 2 a.m. and my girlfriend's awake beside me, panicking, doesn't know what to do because I can barely speak. I'm in that much pain. And so I ended up in the emergency department at the hospital, and I explained to them, this is my case, and they couldn't do anything for me. I hadn't lost any bodily functions that the nerves control, so they weren't prepared to do anything for me. There's nothing they could do. And for the next 2 weeks of my holidays, I was bedridden and housebound. I couldn't do anything. I couldn't hang out my washing. I couldn't cook dinner. Nothing was normal anymore. So from this point, I went back to my GP and basically got an open letter for medical leave saying that I wasn't to return to work until my surgical procedure had been finished and I had recovered. And that was expected to be 3 months down the track. So I hadn't been to work from July, the start of July, all the way through to what's going to be, mid to late November. So as that 2 weeks passed, I'd actually been back to the hospital a total of 3 times, and once in an ambulance. And one of the attending paramedics that came to my bedside that night actually informed me about another medication that I could potentially take advantage of called tramadol. And tramadol had the added benefit of being a muscle relaxant to, help release the tension in the muscles around my back, which had caused a lot of pressure to be placed on my disc, and it's just a compounding problem. So I approached the GP and got a prescription for 100 milligrams of tramadol to take twice a day, and I continued to live through July, through August, in a great deal of pain and very limited mobility. I didn't have much of a life at that point, and my mental status and health was also wearing very, very thin, because when you can't move, without activity, your body is useless, you know, and without physical activity or exercise, my body started to deteriorate. I started to put on a lot of weight. I didn't change how much I ate because, and yeah, the downhill kept going. And in late August, I'd had quite enough of it and went to Facebook and put a long-winded post on Facebook about my current situation at that point, or my journey up until that point. And it wasn't a cry for sympathy or you know, I wasn't seeking the likes or the cares or anything like that. I had to express what I was going through, not necessarily to people that would listen, but just a platform to be able to get out my feelings, emotions, and whatnot. You know, like standing on a mountaintop and shouting and proclaiming your love for someone, except crying in pain. So, yeah, August was pretty terrible, and the whole while from July to receiving my surgical date, I kept pushing the bookings department. I kept asking them, because I was never given much notice for any procedure that I went through, as I explained. And so, hoping that this might be different, I kept bugging them, kept asking, you know, what's the status of my case? Where do I sit in this queue that, you know, I don't know how long it is. So, yeah. If I couldn't do anything, at least I could ring people on telephone, right? So September rolls around and I'm starting to get really anxious about what the heck's going on with my case. And I happened to be out shopping with the girlfriend, and I got a phone call from the surgical bookings department at the hospital, and they said, "We've got a date for you." And I couldn't have been happier. I had waited this day, but guess what the date was? The 29th of September. So they had a day to spare before meeting their 90-day obligation. And I said, I don't care, let's do it. Whatever, let's just have this over and done with. I can't wait. So the catch was they had to fly me to Brisbane to undergo this procedure because the surgeon was not able to make it here in time and basically operate on me. So they paid for my flights to Brisbane, and it was a couple of days later, I got a phone call again from the bookings office saying, "Sorry, we have to delay your surgery date by another couple of days to the 2nd of October. I was flown down on the 29th of September to Brisbane, and I stayed with my friend in the city until surgery date, which was the 2nd. Okay, so October the 2nd, it's 6 a.m. and I arrive at Brisbane Private Hospital. I complete all the paperwork with the nurses. I get changed into my patient gown. I briefly meet the anaesthetist at my bed, and he goes to put the needle into my hand and misses it, so he goes into my arm. But I had I finally got to meet this surgeon who was a complete celebrity ghost. Neurosurgeons are very busy people, and when you finally meet them, you're kind of starstruck. You're like, you're impossible to get a hold of, and now I'm finally meeting you. Sign my leg. But finally got to meet him, and exchanged a bunch of signatures again, and got handed a Sharpie marker to mark the faulty leg and which side they would be operating on. And I was wheeled into the operating theatre, felt a sharp stabbing pain in my right shoulder, and the world faded to black. When I woke up, I didn't have any pain in my leg, or very, very little relative pain compared to what I was used to. And all I could really feel was the surgical site pain where they'd made the incision into my back. So after the operation and I'd gained consciousness again, I had a bit of a post-op meeting with the surgeon, and he explained to me what my situation was, that not everything went as flawless as expected. When they went to remove the chunk of bone that was pinching my nerve, they had made a small tear in my dura, which encases the nerve, and I had a small CSF leak. I want to read to you the whole report just so you can understand exactly what happened. Oh, hello there. I would like to take the time to now read to you my operation notes, and this is how it all pans out. So the operation is a minimally invasive lateral recess decompression left L5-S1. So the gloves on time was 8:35, gloves off time was 10:10. So yeah, an hour and 40 minutes-ish. Okay, so here's the body. Contemporary procedures for identification of correct side, site, and patient were followed, including pre-operative marking of the affected limb by Mr. Trotter, intraoperative display of the pre-operative MRI, and time out. Okay. General endotracheal anesthesia was admitted, and Mr. Trotter was placed in the prone position on the Jackson table. So basically, face down, bum up. The skin on his back was doubly prepared with alcoholic betadine, and the proposed incision line was infiltrated with 0.75 ropivacaine. SCDs were applied and activated. 2 grams intravenous Kefzol was administered. So I'm assuming that there was basically cutting me open and pumping me full of anesthetic. The reference arc for the brain lab was attached to the right-hand side of the bed. Lateral and AP images were obtained at the lumbosacral junction and transferred to the brain lab for navigation. So I assume that is them using some 3-dimensional wizardry to exactly locate which way the dilated tubes have to go in. Okay. A 2-centimeter incision was made just to the left of midline over L5-S1 level. A 16 millimeter by 6 centimeter tube was placed over the L5-S1 space using a muscle dilating approach. The microscope was introduced. So all the work that was done on this procedure is done through a microscope, because they only get to go through a 16 millimeter hole. The L5 lamina covered the L5-S1 interspace. The drill was used to remove the lamina and expose the ligamentum flavum. A pull-down technique was used to enter the epidural space. So basically they'd parted the ligaments so that they could access where the nerve roots are. Do have a look on Google Images and see what you can find, and you'll see that the spine isn't just a stack of bones. It's all rigidly held together with all this fibrous material, all your ligaments. As presented by the MRI, the lateral recess was vertically oriented. Bone and ligamentum flavum was removed to decompress the S1 nerve, which appeared to have been tightly compressed. The dura, the nerve casing, was adherent to the caudal end of the decompression, and a small duodenum developed in the lateral wall of the nerve root. So let's break that there down because this is getting into the nitty gritty. So bone and ligamentum flavum was removed, and so they ground that out, chopped it out, whatever, and it decompressed the S1 nerve. Now the nerve was so tightly packed that when they were removing that piece of bone, it put a small tear in the nerve casing. The nerve was adequately decompressed. A right angle probe and retracting the nerve root medially was used to inspect the disc. So they basically shifted everything out of the way to have a look at the disc and see whether it needed any material removal. There was not a disc prolapse of sufficient size warranting discectomy, so the prolapse wasn't bad enough that they had to remove any material from there. After taking away the piece of bone, it was enough room for the nerve to run free. Subcutaneous fat was harvested and placed over the duodenum, followed by seal glue. The wound was closed with Vicryl, probably a stitching brand, and continuous nylon before being dressed with a Dermabond Preneo dressing. Anyway, that's the surgeon's notes and a breakdown of what I understand is happening under the knife. So I'm laying there awake and just had my meeting with my neurosurgeon about basically what I just read to you, and I was not to move for the next 24 so hours to let that tear in my spinal cord lining, to heal. And if I was to sit up, there was a risk of me developing that leak again. So I laid flat for the next 24 hours. The nursing staff at the hospital were great. And the following morning, I met with a physical therapist who was going to help me stand up for the first time after the surgery and go for a walk around the ward and just give me the do's and don'ts of the recovery post-op, okay? So at that point I had very little, if any, nerve pain, just the operative pain, and I was given a sheet full of exercises to do for the next 2 weeks or so for recovery, and they were very basic. They weren't stretching exercises, they were just minimal strength exercises to help with the core strength. I rested for the remainder of the Saturday, and then my friend came to pick me up that afternoon. Yes. I was in bed for a couple of days there, and I just watched Netflix and let my body heal up, and every day I could feel less pain at the operative site. So the physical therapist said no bending for the next 2 weeks. If you have to pick something up that you dropped, or something that's on the floor, you'll have to squat down to pick up, and keep a straight back, use your leg strength to lift yourself up and down. At the end of the week I was flown back home, and the following day had my stitches removed, as it had been 8 days at that point. So after about 2 weeks, I've signed back up with my gym. I'm only doing some very light exercising at the moment. I walk on a treadmill, ride a bike, and do some stretches. That's about all I do until I feel like I've recovered well enough and I can begin my strength exercises and get back to where I used to be before all this shit show happened. But I should be back at work again after 6 to 7 weeks, and at this point everything's going good. My recovery's a lot better than I expected, and all I can really say is thank goodness for the neurosurgical field. Any part along this whole journey, you know, even though the exercise back in January wasn't helping, I still kept doing it because I knew that if I'd stopped, things were going to get worse. And basically, when the worst did happen and I wasn't able to move around, I couldn't exercise, things did get really bad. I put on quite a lot of weight too. I went back big time. If anything, I was eating the same amount. I hadn't increased the amount of food I ate. It's just I didn't leave the house. I didn't walk any further than, you know, bedroom to kitchen to lounge room sort of thing. So the lack of activity really packed on the kilograms, and I wouldn't doubt that the medication had something to do with that too, and adjusting how my body metabolized food and stored food. So I'm glad to be off the medication, mainly the painkillers, but I have to I'm weaning in the process of weaning off the Lyrica, down from 150 twice a day down to 75 once a day. And I found that after I tried to stop it just cold turkey, it didn't work very well. It worked okay for the first 3 days, but withdrawals started to set in, and I was aware that that could be an issue. But I found that about 3 days in, I had terrible night sweats, and I could only attribute that to withdrawals from the medication. And I'm not sure if it's a combination of all of them, but I've been warned that Lyrica or pregabalin's the worst. So yeah, full recovery is expected by mid-November. That'll give me my 6 to 7 weeks, and I should be back at work by that point. So fingers crossed. Which way, doesn't matter. Fingers crossed everything goes well and keeps going well. My core strength will return as I exercise. Yeah, don't lose hope. If you've got these niggling problems and you've got something not right and you know it's not right, don't give up. You know you best, and if you've exhausted every avenue, surgery might be the best option for you. In my case, it was after I'd stuck up with all the pain and the unnecessary, medication and all that sort of stuff. It ended up being what I wanted it to be. And my physio back at the beginning said that you don't need surgery. He's had cases worse than mine after seeing my MRI and telling me that people get better by themselves with exercise. I knew when enough was enough. I guess that's it, guys. If you have any questions, please feel free to ask them in the comments. And if this video has been helpful for you to be able to look at my case, leave us a like, okay? I'm gonna finish my coffee. Drink lots of water, exercise frequently, look after yourself. See you later.